they're an adult child, or or if addiction. Oftentimes, it's even in middle school. We have been talking about that before before the show. Even middle school, kids need to be told about the dangers of addiction and that kind of thing. How does a parent go about talking to their child about this?
Well, I think they can start in a non-judgmental manner, open-ended questions that would allow, what do you think about this kind of thing? There's actually an excellent toolkit on the New York State Office of Alcoholism and Substance Abuse Services website called the Kitchen Table Toolkit. And it's fantastic because it gives examples of how to approach youth, age appropriate. So what would work for the little one, and what you might say to your teenager. But in general, you don't want to come at them in a attacking, judgmental way. You want to kind of open the door as much as possible. It's tough with teenagers, though, no question there.
Sure, you don't want to come in an angry fashion. You also don't want to allow your children to give you the answers that you want to hear.
Right.
Oh no, Mom, Dad, I'm fine, this is great. And then, some parents will say, okay, I've had the conversation, I'm done. It can be almost as uncomfortable as the sex education talk. And, so be direct and come right out and ask. And, and let your child know that it's okay. We're here. We will help you. We will help you.
So it starts with that conversation, and the resources from Oasis that you had talked about would be a really good starting point. But if a person wanted to get into recovery, what's the next step?
Well, there are a lot of services in our area. They're listed on Go Broome County. There's many services, which is a wonderful thing. Sometimes there is a bit of a waiting list, but there are other ways to access services as well. Calling New Horizons over at Binghamton General Hospital, United Health Services is one. Getting an assessment, talking to a professional who can assess the person who might be addicted, and then the level of care is determined by that assessment, pretty much. Or Addiction Center of Broome County, ACBC, also does that.
Are there support groups for parents of children with addictions?
Yes, there is Al-Anon. There's other self-help groups for the addicted person. You could start the process of recovery with a simple call to the Broome County Sheriff's Department too. The Broome County Sheriff's Department will direct you and give you the help, will help you get these services in place.
And so what they do is they enter in Fairview Recovery. They would start at the crisis center, and then from there they may get involved in a residential program.
Yes.
And when they get into the residential program, what are some of the things that happen there at the residential level?
They typically go into the community to one of the outpatient clinics, ACBC or New Horizons, for the actual treatment. That's during the week. We call it the halfway house. That's the old term, but it's now community residence. We offer life skills groups that go from learning how to deal with finances to appropriate nutrition to how to avoid, addiction prevention, how to avoid certain situations. We really do the full spectrum of life skills. What we see at our residences is people behaving, so it's a whole other thing than treatment itself, because people can talk the good talk in treatment, but we actually see the behaviors. So we're seeing the real thing, and the staff is very skilled at helping people change their behaviors.
Right. And so once they graduate from the halfway house, then they get into you had said that there was something like a HUD program that they get involved in with, which you all help organize. Is that correct?
Yeah, we have apartments in the city of Binghamton where they can go next. They still have a lot of oversight. They're still sometimes in treatment. Often they're going toward a vocational goal, either at BCC, BU, maybe BOCES, working toward some kind of career. Beyond that, we can help them with just paying the part of their rent and having a case manager for as long as they need that. They're really on their own at that point, but they still have some support from us.
I heard from one of your employees that there was about 12 people that were enrolled at BCC last year. Mm-hmm. Is that about right?
Yeah.
Mm-hmm. Yeah. It seems like it's a really good way to enter into that, especially if you're in recovery, because oftentimes you need some support in order to stay in recovery.
Absolutely.
You said, like Don, you had said, you need to be open to receiving help when
Absolutely.
you're in recovery.
You have to want to change. I like to tell people that I can draw you the map. I can't make you follow it.
Right.
Lead the horse to water, can't make them drink. A person has to form a little spark of wanting to change. Which is I think one of the key roles the crisis center can play. We have people come into the crisis center and maybe not stay there full time, or maybe not accomplish all the goals we want to see accomplished, but a seed has been planted, and now hopefully they can get out there and that seed starts to get watered just a little bit and a little bit and a little bit more, and they come back and they see, this is I'd really rather do it this way instead of the way I was doing it, because that's not working for me anymore. It just doesn't. My life is completely unmanageable. I do not know how to do this. It's one of the wonderful things about the supportive living system that you can go into after the halfway house. You can take, I've referred to it as taking a vacation from life for a little bit. You don't have to worry about, to treat a person with the disease of addiction that's homeless and doesn't know where their next meal come from.
Right.
They're not worried about getting sober at that point. They're worried about, where am I going to lay my head tonight? Where am I going to get my next meal from? Where am I going to get a shower from? Where am I going to get where am I going to get my next drink of water from? So some simple, basic things like that. And when you can come into a place like Fairview Recovery Services, get started with the crisis center, get some of those meds or some of those needs met, it allows you to open up to the other things that need to be addressed, the behaviors, the attitudes, and the thinking that go along with the addicted person. That allows them, they can go into the supportive living situation and not have to worry about, is my rent going to get paid this month? Am I going to have my next meal? And it allows them to focus on going into BU or BCC and becoming that productive person that everybody's seeking to be. And they just need that help getting there, and it's a wonderful place to get that help. It can be, I've seen some amazing transformations happen.
Yeah.
I've always said I'd like to take pictures of when they hit our door, and even as short as that, 2 weeks later, take another picture. A lot of them are walking out of there with a smile on their face and ready to take on what they need to do. The other part of that is there's that sense of relief, is that I don't have to do this alone.
Right.
They finally figured it out, that I can do this one step at a time.
Yeah. And it's important to have stories like that, and folks like you, Michele and Don, who've been through recovery. Mm-hmm. Or you're in recovery, but 32 years for you and 10 years for you, and for people to know that there is hope.
Absolutely.
Yeah,
there is hope.
There is hope, and they don't have to do it alone. And that's one of the ways that we can stand up straight is by entering into community, to experiencing joy with interaction with people, to find love and acceptance and the beauty of just being inside of a relationship.
Sure.
I think that's an important first step.
Absolutely. The beauty of having a relationship with yourself.
Yeah.
It's one of the most wonderful things in the world.
Well, I want to thank you both for being on Encounter. Thank you for helping us understand a little bit more about how addiction works and how a person may be able to enter into recovery. So thank you both. Thanks for being a part of our conversation today. And thank you for being one of our loyal listeners and watchers. Thank you so much. Have a great day.